here's what we've done, and here is how we've set the table. I'm going to give you the date right now when the governor is going to sign our legislation into law. November 19th is a Thursday. So if you want to, it's exactly a week before Thanksgiving. We're going to receive a Thanksgiving present a week before the actual holiday, and we'll just have a blowout celebration for a week. November 19th, 1863 is a date in history that many of you know. It's the date that Abraham Lincoln delivered the Gettysburg Address. I am in the process of shopping for a desk and a chair and a pen, possibly one out of the Lincoln Library, for the governor of Pennsylvania, Ed Rendell, to use to sign into law the Pennsylvania Health Security Act of 2009. The Family Business Health Care Security Act. That's the date. The governor has a rather sizable ego. And if he can be positioned for one of the most historically momentous events in American history, he's going to jump on it. Now, in the run-up to that, you should know that we have 50 governors, and through the cleverness of our organizing, right? Single-payer people are the ones who got Arlen Specter and Joe Sestak to say single-payer is on the table when the national leadership wouldn't. And we've got our own specific single-payer candidate, Bill Courts, from Pennsylvania, from the western part of the state, from Pittsburgh, running for U.S. Senate. So single-payer is, in fact, the #1 issue in this U.S. Senate race. And every time you show up at a forum, make sure you raise that topic. We've got these guys running. And they're talking now about single-payer, which is really quite a remarkable feat. We have to do the same thing for the upcoming governor's race. We have 50 governors. There's only one governor on record, and 3 times, and on YouTube, each of the 3 times, to commit to signing our legislation upon passage. And that would be Ed Rendell. We've got the only governor in the nation. And that's notable because single-payer legislation passed in California in 2006 and again in 2008, but Arnold Schwarzenegger vetoed it twice. But something you should know, and this is I did my high school and college years in California, so I'm a bi-coastal boy. No bias against California. I love California. I was there, in fact, last week, talking to the legislative leader, the single-payer legislative leader's point person, his legislative director. But California has a particular problem, and that is that even after getting the bill to pass, again, as certainly it will, and if they get a governor to sign it, it then has to go before the voters, a referendum that has to be supported by 2/3 of the electorate. Getting people to raise taxes on themselves is really a tall order. It's really a difficult order. And that's why the California nurses have put Pennsylvania on the center of their radar screen, and the California public employees, and the League of Women Voters, and Progressive Democrats of America, and PNHP. By the way, the lead lobbyist for PNHP wrote the legislation for Dennis Kucinich to enable the states to move forward. So first, then we have the governor committed to signing. So at the end of this rainbow, we're actually going to collect the gold, we're going to collect the goods, we're going to get our system signed into law. And it becomes law on January 1st, 2010. By the way, what's happening in Washington, D.C. right now, does anybody know the institution date? No matter what passes, if anything, does anybody know the date that that law will go into effect? 2013. 2013. Why 2013? That's 2 election cycles away, 1 presidential election away. Life is going to change a lot over the next 4 years, I dare say. So those courageous politicians who were talking about throwing all this legislation together in Washington, D.C., they've all essentially agreed that, well, we can wait till 2013 to institute that. Well, the fact is that Pennsylvania, I shouldn't say the fact, but our determination is that Pennsylvania will establish the answer for the nation even before the irrelevant legislation that is in the process of cranking out of Washington, D.C. becomes the law of the land. Secondly, and I allude to this with the problem of California, funding is not the issue here in Pennsylvania in terms of getting a referendum and people voting for it, because once it's signed into law, it's the law. It's the law. And I'll spend a couple minutes going through the basics of the legislation too. So that's number two. We don't have to worry about getting voter approval to fund taxes to fund single-payer health care. Third, as I mentioned at the top, we're getting Republicans to sign up for this legislation. We've got Republicans who are participating. We're getting Republican hearings in the state Senate. We're getting hearings in the state House. The bill is moving forward. It's getting support from Congress through the Kucinich Amendment, which is getting more Republican support than Democratic support. So all of these point to victory this November 19th. So make your reservations for Gettysburg. The hotels, I understand, are filling up. So the challenges that I have faced, that Walter has faced, that our 10,000 coalition members have faced, that you would face as you take on this battle, the challenges that we face really are fear, ignorance, and cynicism. Because the facts are all on our side. The economics are all on our side. The morality is on our side. And small d democracy is on our side. The legislation is entitled the Family and Business Health Security Act. There are 9 pages. I'll go through these very quickly. Very simple. And you can download this from our website, healthcareforallpa.org. Look at that. Civilized healthcare for all. Everybody in, nobody out. Wow, what a concept. What a country. How do you do it? Well, Walter outlined, but I think it's important just to clarify. The single-payer system, I use the term one-payer when I talk to politicians, because a lot of them are scared when they hear single-payer. Fireworks go off in their head. It's a weird thing you watch, you know, when you're sitting across the table. So I decided, I think the comfort level for these folks is to talk about it in terms of one-payer. Same thing. It doesn't scare them away. One-payer, efficiency, and savings. And by that, we're talking about eliminating the profit-first, not for-profit, profit-first insurance industry. Remember, the Blues operate exactly the same as Aetna and Cigna. Their medical underwriters predetermine how much money they're going to make before a single healthcare service is paid for. Their profit is guaranteed, no matter what. No matter what. So that's about 18 to 20 cents out of every healthcare dollar that vanishes. And by the way, Medicare's overhead is about 3.1 cents. So 18 cents they're blowing out the back door. But something that I didn't understand until about a year into this campaign is that there's an additional waste, fraud, abuse, bureaucratic charge that's imposed on our system, and it's imposed on our hospitals, our doctors, and our businesses. Now, I knew that there was a problem there, but the problem stemming from waste, fraud, and abuse for them is about another 17 cents out of every healthcare dollar. So we're not talking 18 to 20, really. We're talking 35 cents is lost out of every healthcare dollar before any services are paid for, if they're paid for. But we're talking about comprehensive healthcare, not bare bones. Primary to long-term. Comprehensive means eye care, dental care, specialty care, alternative cares, therapies, mental health. The list includes prescription drugs, medical equipment, hospice care, substance abuse. Nobody can actually afford this health care on your own today, but if everybody pays their fair share, right? Everybody in, nobody out, it works.